HIV. HIV stands for Human Immunodeficiency Virus. It is a single-stranded RNA virus belonging to the family Retroviridae of subfamily lentivirus. Lentivirus based on envelope protein are basically of two types, that is HIV-1, which is the most common serotype, and HIV-2, which is also known as simian virus. HIV-1 is further divided into four groups, that is M, O, N and A, out of which M is the most common serotype, having 10 subtypes, and out of which subtype C is the most common. Each HIV virus has 3 structural genes and 6 non-structural genes. The 3 structural genes are the ENV gene, which codes for envelope protein. It gives rise to GP120 and GP41, which are important for entry and fusion of the virus. And Pol gene, which codes for enzyme inside the virus. The enzymes are protease, integrase, and reverse transcriptase. Third is the GAG gene. GAG gene codes for P17, that is the matrix protein, and P24, which is the core protein. Coming to the 6 non-structural genes, they are TAT gene, that is transcription activation gene, REV gene, VIF gene, VPR gene, NEF gene, and VPU and VPX gene. Coming to mode of transmission, the HIV infection can occur either by parenteral method, sexual method, or vertical transmission. Through blood transfusion is the most common way of spreading. Others can be through abuse in IV, drug abuse. Third is a needle stick injury. Fourth is vertical transmission, especially occurs. The highest risk of vertical transmission is during delivery. Life cycle of HIV. First is entry, that is the HIV virus enters and attaches into the CD4 cell via GP120. After attachment, it undergoes change and it binds to co-receptors CCR5 and CXCR4. It undergoes conformation change in GP41 and fusion occurs, which leads to uncoating of virus. Now the viral DNA is formed with the help of reverse transcriptase when RNA is converted into DNA with the help of RNA-dependent DNA polymerase. Third step is integration of the viral DNA into the host DNA through integrase. Fourth step is protein synthesis and new viral RNA synthesis. Fifth step is proteins come to the cell surface and immature virion is formed. Sixth step is maturation and cleavage of the large protein precursors with the help of protease. Infection in a person with HIV infection occurs in 3 stages. First is acute HIV infection, where incubation period is between 3 to 6 weeks. Mainly patient is asymptomatic, that is there is no complaints of diarrhea or weight loss, and patient may have complaints of fever, sore throat, and lymphadenopathy. CD4 count is normal here and there is no risk of opportunistic infection. Diagnosis is by HIV RNA PCR on the 12th day or P24 antigen level on the 16th day. Second stage is the period of clinical latency. Here, the virus now enters into lymphatic portals. Here also, the patient is asymptomatic. The latency period can last up to 7 to 8 years. CD4 count here also is maintained and HIV RNA load will be of low level. Patient may complain of chronic lymphadenopathy. Third stage is chronic persistent infection, where due to the chronic persistent infection, there will be an accelerated viral infection and the disease will be full-blown disease, and here it is what we say as acquired immunodeficiency syndrome because of destruction of the immune system. Now, according to CD4 count, we can stage it into 3 stages. That is stage 1, where stage 1 will have a CD4 count of less than 500, more equal to or more than 500. Stage 2 will have 200 to 500. Stage 3 will have less than 200. AIDS defining conditions are 3 most important malignancies are Kaposi sarcoma, invasive cervical cancer, and lymphomas like Burkitt's lymphoma and immunoblastic lymphoma. Viral infections like cytomegalovirus, HIV encephalopathy, and herpes simplex virus. Parasitic infections like toxoplasmosis, cryptosporidiosis. There are other opportunistic infections like pulmonary TB, pneumocystis cerevisiae, which are very common. Diagnosis is based on combined antibody antigen testing. Here we first do antigen. We look for antibody against envelope protein and P24 antigen. If positive, then we have to again check for antibodies against HIV-1 and HIV-2 specifically. Depending on that, we'll come to know if the infection of the patient is positive for HIV-1 or HIV-2 or both. Coming to management is antiretroviral therapy. The goal of antiretroviral therapy is to treat everyone, that is treat all. So first line drugs that we use are NRTIs. Commonly used NRTIs are lamivudine or emtricitabine or abacavir. NTRTIs, that is it can be tenofovir alafenamide and tenofovir disoproxil. Then we have NNRTIs, that is nevirapine, efavirenz, delaverdine. Integrase inhibitors like raltegravir, dolutegravir. Protease inhibitors like lopinavir. The three drug combinations that we use are one NRTI, one NTRTI, and integrase inhibitors. The most commonly used combination is emtricitabine 200 mg daily, tenofovir 300 mg plus dolutegravir 50 mg daily. According to NACO, we can also use lamivudine and for NRTIs, and for integrase inhibitors we can use efavirenz if infection is due to HIV-1 and protease inhibitors if infection is due to HIV-2. Prophylaxis in case of post-exposure prophylaxis should be taken within 72 hours because after that the effectivity decreases. The PEP that we give is emtricitabine plus tenofovir plus dolutegravir. We give for 28 days, and after that we can stop when the fourth generation antigen antibody testing is negative. The fourth generation antigen antibody testing, just like I said, is antibody testing against envelope protein and P24 antigen.